Hi, I'm Beth, Head of News here at Manx Radio. We're talking about healthcare now. It's something that concerns so many people, and especially the provision of healthcare out of hours. Manx Care is changing things a little bit with the Manx Emergency Doctors Service, or MEDS, and I've been talking to the Executive Director for Health Services at Manx Care, Oliver Radford, to find out more.
So from next week, Monday the 8th of January, we are closing MEDS from midnight to 8 a.m, Monday through to Friday.
Why is that?
Well, there's a couple of reasons. The first is demand on the service during that time. Our data shows that during that period, that 8-hour period, the demand on the service is significantly reduced. We have between 1 or 2 appointments per night during that period, which we feel that can be accommodated within our other services, primarily ED.
Thing is, though, is that some people phone MEDS and get some reassurance from just speaking to a doctor, and we know that waiting times at ED, hopefully not overnight, I suppose, but have been quite long. So is there some concern about putting this strain on another service?
Well, we've considered that, as your listeners probably are aware, that there have been periods during 2023 that we had to close MEDS during that overnight period. For those periods of closure, we did analyse the data on those days that we closed MEDS during that period, and we found that there was very little impact both on the ambulance service, ED, and also for GPs the next day. We are reasonably confident that it will have a minimal impact. Clearly, during the period of the 3 months of closure, taking us up to the 31st of March, we will continually monitor that data to see whether there has been an impact on other services, and looking at that data, reviewing that data, we'll make any tweaks that we need to.
It's difficult to know, isn't it, if somebody turns up to ED, whether they might have phoned MEDS, though?
It is, but all patients who attend ED get triaged. Our triage time standard is within 15 minutes. Because of the busyness of ED overnight, we tend to see around 1 attendance an hour during that midnight to 8 a.m. period within ED. So we are reasonably confident that those patients will be triaged within the 15 minutes. During that period of the 3 months, we will ask patients if they were intending to use MEDS, if it had been open, and that is part of our data collection that we'll be using during the 3-month period to evaluate whether this is something that we will continue on beyond the 1st of April.
So that reduction in demand is one of the reasons for this. Staff issues as well. What can you tell us about that?
One of the reasons that we have made this decision to close is that we have reviewed the pay that the GPs receive, the MEDS GPs. All of the doctors across Nobles, Ramsey and Mental Health received a new pay offer. That pay offer wasn't extended to MEDS GPs at the time, but what we have done is to, in December of last year, 2023, we have similarly increased the MEDS GP pay, but in order to minimise the impact on the overall financial cost of MEDS, the closure has balanced off the impact of the cost increase, the salary increase that we've seen.
So this is going to be reviewed at the end of March. What would it take, I guess, for that overnight service to be reinstated?
Well, it will be primarily the impact on the clinical delivery of the service. If we're finding that a significant number of patients have been adversely impacted, then we will review it. One of the safety nets that we have put in place, so although we are closing the med service from midnight to 8 delivered from the diabetes centre, we are going to have a GP on call who is going to be based at home. That GP will be able to be mobilised either by the ambulance service or by the hospice. So if there's anyone who requires treatment at home where it would be a real negative impact to bring them to hospital for treatment, so that might be patients maybe on an end-of-life pathway or patients who are housebound, the GP will be able to be mobilised by either the hospice at home team or the ambulance service to get the medical care that person needs in the home. We're expecting those to be minimal. The data that we've collected over the last 3 months has shown during the midnight to 8 a.m. period, there only being about 1 or 2 home visits delivered per month during that period. But the on-call GP will provide a safety net. Again, we will, as part of that, the ongoing review of the closure, we will evaluate the efficacy of the GP, and that will be part of our overall evaluation.
So I think that the key message is if people need medical services overnight, there is still going to be something available.
Absolutely. For anyone who feels like they need medical attention in an emergency situation, we obviously 999 is open 24/7, 365 days a year, as is ED. The doors are always open within ED. And so if anyone feels as if they need medical attention, then 999 or ED.
I guess Manx Care is aware that some people may feel that this service is just being taken away, and that once again the Isle of Man is perhaps falling short compared to other areas around the UK, for example.
Well, yes, I would agree that most areas, if not all areas, do have an out-of-hours GP service as well as an ED ambulance provision. The UK enjoys the 111 service, which we don't yet have here, but that is part of our urgent care transformation programme to introduce 111 service, so people can ring 111, speak to a clinician and receive that reassurance either by a paramedic or an advanced clinical practitioner or a GP. That's something that, again, is in the pipeline as part of our urgent care transformation, but something that won't be available immediately, probably in the next, say, 12 to 24 months. But we do have other initiatives in the pipeline, such as the Advanced Clinical Practitioner Project, which is in the process of being rolled out within the ambulance service, which will put a advanced paramedic on the road 24 hours a day who will be able to undertake more advanced diagnostics and treatment in the home. And that's something that we are just made the first appointment of our first paramedic consultant who started with us in December, and adverts are currently out for advanced clinical practitioners or trainee advanced clinical practitioners who can work within that service.
Just finally, on the meds issue and people being redirected to ED, it comes at an interesting time because people have been told previously only go to ED if it's an absolute emergency. So I guess there's a little bit of a conflict there, and potentially people are going to wonder who to go to when meds is open. And meds will be open until midnight and at the weekends.
Yeah, so meds will be open from 6 p.m. to midnight, Monday to Friday, and during the 48-hour period of the weekend. So we'll open at 8 a.m. on a Saturday and then close 8 a.m. on a Monday.
Just on a more positive note, there have been people struggling to get on-the-day appointments at their GP practice for the past couple of years. I don't think that's unique to the Isle of Man. What's happening to address that?
So as part of our Winter Pressures programme, we've allocated some funding to employ a locum GP. They will be based within a GP practice in Douglas, and they will be solely providing on-the-day appointments. As you've mentioned, people who ring up their GP practice at 8 a.m. and maybe can't get an appointment on the day, sometime advised to ring the next day, sometime advised to attend A&E. Within the new system, which is coming online next week, GP practices will be able to, if they don't have any capacity within their own practice, to book an appointment within the practice in Douglas with the locum GP. That locum is going to be delivering around 30 appointments a day. So that's 30 additional appointments than what we have at the moment. Obviously, it will mean that the patient needs to travel into Douglas to attend, so they do have the choice to accept that offer or not. If they do, they will be seen during the day. Each GP practice will have an allocation of appointments each day depending on their size, and also we will have the ability to book patients from A&E into there. So if somebody attends A&E with a primary care problem, the triage nurse or the doctor will be able to book them into that appointment as well. They'll only be booked on that day, so we won't be booking in advance. They'll only be booked on that day, but we think that will be a real benefit to people who feel as if they need medical attention that day. Again, like the meds closure, we will be evaluating the efficacy of that. Although the funding for that locum is only available until the 31st of March, obviously we will see whether that is having a global benefit to the primary care system. And if it is, we will look to try and find funding for that going forward.
Are you able to give us the details of the funding involved?
As part of our budgetary allocation for this year, we allocated a set amount of money for additional resources for Manx Care, not just the hospital, but for the whole health system to cope with the extra demands of winter. One of those initiatives being the additional GP. We've brought in some additional medical resources into the hospital, brought in an additional pharmacist who is focused purely on discharge medicines reconciliation. We've brought in additional physio and occupational therapy resources at the weekend, both in the hospital and in the community. We've extended the opening hours for our day case unit to reduce the likelihood of people being cancelled on the day because of no bed capacity.
How much does all that cost? Do you know the figures?
Our allocation for winter pressures was $250,000 for this year.
With regard to the on-the-day appointments, is there any indication as to how many people struggle to get appointments on the day with their practices?
We don't have any firm data on that, but we do have the data that we see in A&E, so people who attend saying that they've been sent here by their GP practice. We don't collect that data formally, but we think that's between about 5 and 10 patients a day on average. That fluctuates. But there are clearly patients who would decide not to come to A&E and instead ring their GP the next day at 8 o'clock. Hopefully for those, this new initiative will mean that those patients will get the offer to be seen by a GP. It may mean that they need to travel, as I say, to Douglas to receive that appointment. But hopefully that will address quite a lot of concerns around being able to access on the day GP appointments.
And how are Manx Care staff feeling about all these changes?
Well, we've had some concerns expressed to us from the wider primary care network about the impact of the meds closure on their demand. But again, we've reassured them as much as we can through the data that we collected when meds had closed previously on those ad hoc basis that there was minimal impact. But again, we just reassure people that our primary care colleagues that this is an initiative that we will continually monitor on a week-by-week basis. If it's starting to have an unacceptable impact on whether that's primary care, ED or the ambulance service, we'll review it. But we are hopeful based on the data that we collect on a day-to-day basis and also the data that we've collected during those periods of closure that impact will be minimal. But, clearly we will keep that under review.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider so our best bits will magically appear on your smartphone. Thank you.